everyone, and for today's video I'm going to demonstrate to you on how to administer enema. So first, let's define enema. Enema is the installation of solution into the rectum or sigmoid colon. So there are 6 purposes in this procedure. First is to promote defecation by stimulating peristalsis. Second, it is a vehicle for drugs that exerts local effect on a rectal mucosa. Third, it is used as a temporary relief for constipation. Fourth, it is used as a removal for impacted mass. To empty the bowel before the diagnostic test, surgery, or childbirth. Lastly, it is used as a beginning program in a bowel training. The things or supplies that we have to use in our procedure. First is we have the rubber pad, enema pack, warm water or lukewarm water, tissue, washcloth, soap, or the lubricant bottle, and we have the clean gloves, the commode and blanket, and an stethoscope for studying the abdomen of our patient. So now for our assessment. So the first thing that we have to do is we have to assess the presence of any bowel disorders such as ulcerative colitis, abdominal pain, verticulitis, abdominal distension, hemorrhoids, or recent bowel surgery, because this condition will actually put patient at risk complications such as perforation or mucosal irritation. The second thing is for inspection. It is very important to inspect our patient to have an effectively baseline data. So in inspection, we have to use our eyes, nose, and ears to see the general contour of our patient if she has marks, lesions, or any bruises in her skin. So you inspect the breath if the patient is breathing symmetrical. So second, or another one, is assessing the patient abdomen through auscultation. And in auscultating, we have to use an stethoscope, the diaphragm on the patient abdomen, and listen for the bowel sound. And the normal sound is about ranges from 5 to 35 sounds per minute. If it's less than 5, it could suggest that it is in hypoactivity, or if it's more than 35, it says that it's hyperactivity. After listening to the bowel sounds and this swishing of the abdominal, the next thing we have to do is to percuss. We have to use our dominant hand and the non-dominant hand. Using the distal part of our middle finger, we can percuss with the dominant hand. Okay, so let's percuss now. So there are 2 kinds in percussing, the direct and in the indirect percussion. So direct percussion is you have to do this. So this percussion is used for there are sinuses that occur. So the next part that we have to do is palpation. So there are 2 kinds of palpation, the light palpation and the deep palpation. And we have to know if there are abnormalities that occur to the patient, abnormalities and texture and tenderness to the abdominal area. Okay. So in palpation, it is very important to palpate. We will know that palpating we can determine and know the internal organs in the abdomen area. After doing the physical examination of our patient, now let's review the patient chart for any condition that may contraindicate to the procedure, such as glaucoma, plastic surgery, and recent rectal surgery. This condition will actually contraindicate to the procedure. If the patient have this, you have to notify the physician whether the procedure will not. So now after that, we can note the last vowel movement, vowel pattern, and vowel sound to establish baseline for the vowel function of our patient. So after that, we have to check decisions order for the patient and verify if the need for enema and also for legality for possessed. So the next thing we have to assess the cognitive and mobility of our patient status. Assessing the cognitive level will let us know patient's ability to follow instructions, assessing the mobility as well if there is a need to put our patient in bedpan or not. So in cognitive level, you can ask questions such as what did you eat for lunch? What did you eat for dinner? What is your birthday? And what town did you came from? In a mobility status, whether he or she could able to go to the bathroom by his own or her own, or does he use an assistant? So the next thing we have to do is to wash our hands. Hands is also part of our assessment. Next one, we're going to prepare our enema kit tube to the container and close the clamp to the tube and fill a lukewarm water. So using a lukewarm water here because cold water can cause abdominal cramps, and hot water, a very hot water, can cause irritation to the mucosal lining. Hi Mom, I'm Jennifer and I am your nurse for today. May I know your complete name, Mom? Can I see your rest, my Mom? Okay. Your doctor has ordered today to give you enema solution. This procedure when we're going to put the solution inside your rectal area to alleviate your constipation that you're feeling right. So mom, this procedure is affordable and by breathing through your mouth, it could really help. So mom, in this procedure, you will feel abdominal cramps, and I want you to hold the solution as long as you can inside your rectal area. So in this procedure, mom, you will be urged to go to the toilet. So at this time, mom, you can be able to go to the bathroom by your own, or you need to have an assistant. So you're able. So after explaining the procedure to the patient, you must have to provide privacy using the curtain around to the room, or you can close the door. Next, we have to raise the level of the bed to a comfortable working position to help the nurse to work at peace. So next, we are going to put the protective pad so it will protect the linen not to be soiled. So sir, I will put the pad underneath. So the next thing we have to do is to hang the enema can to the IV pole, or just pretend that there is an IV pole in here, and then unclamp the end of the tube to flow the solution all the way to the tube. Put the patient into the left position side or Sims position with the right knee flex. It will allow the solution to flow downward. I'm going to turn into the left position. Next thing we have to do is to cover the patient with a bath blanket, or drape the blanket exposing only the buttocks area and the rectal area. This will provide privacy to the patient and remove the top sheet of our patient. So now we're going to drape the blanket, exposing only the buttocks area. This will provide the patient to have privacy. For using the diamond technique, it will not expose the skin of the patient. So the next thing we have to do is to put gloves. This is to prevent the transmission of bacteria and for infection control. The next thing we need to do is to lubricate the tip of the tube using the warm soluble lubricant. But because we are just pretending that this is the solution or the tube, so we have to gently lift the buttocks and of our patient. Next is we have to gently lift the buttocks of our patient to locate the rectal area. Tell the patient breathe using their mouth to prevent the sphincter. So sir, please breathe slowly using your mouth. Okay. So now that we have located the rectal area of our patient, gently insert the tube in a circular motion to avoid traumatize to the rectal wall. The distance that we're going to insert this solution is 3 to 4 inches. Now in putting the solution, we have to have the distance. The reason that why we hang it to hold, we hang and hold, is the faster the flow of solution is the greater flow in the rectum. So squeeze the solution in a circular motion. Okay, sir, if you're really need to go to the bathroom, if you can hold it as you can, or if you're not really cannot hold it anymore, just let me know. So I will remind you not to flush the expelled solution because I need to have more assessment for the solution if you need more enema. Okay, sir? Patient or really need to expel the solution. Elevate the bed into a low position. The whole procedure, we need to provide privacy, and after that, if the patient has already expelled the solution, we have to assess for perineal care. The perineal care, we have to assess the patient into a comfortable position. And we're going to dispose our gloves. So let me remind you that if you it is necessary to change our gloves while doing the procedure if it's hard to decrease contamination and transmission of bacteria. We have to remove the gloves. And do the aftercare. We have to wash our hands to remove bacteria and put our patient blanket into patient in a comfortable place and remove the bath blanket. Evaluation, we have to evaluate and observe the response of our patient throughout the procedure to know if the patient is comfortable or not. And next is we have to observe the skin color rate, and we could also observe the sign of excessive fatigue. Next is we have to observe also the consistency of the color of the stool with the patient tolerance during the procedure. Was there any abdominal cramps or required the documentation of enema that we use during the procedure? So that would be all. Thank you.